Hello, my name is Suzanne Robotti, and I'm the founder and president of MedShadow Foundation. Our foundation's mission is to save lives and ensure quality of life for anybody taking medications. We enable everyone to understand the full risks and the benefits of drugs, and we offer alternatives to drug therapies when they are safe. We support evidence-based medicine, even with alternatives from drug therapies. MedShadow Foundation has two programs, MedShadow.org, which publishes articles on medicines, diseases, and chronic conditions, and DES Action, which supports, educates, and advocates for all those who were affected by the pregnancy drug diethylstilbestrol in the 1940s through the 1970s. The drug affected the mothers given it, their children, and now we're finding out it's affecting their grandchildren. Today, we have two people to interview who are both in the COVID-19 vaccine trial. Each are in different trials. The first person to introduce is Britt Vikstrom, who is actually the community manager of DES Action, and Matt Reinhard, who is an attorney in Washington, D.C. So you two can interrupt each other and talk over each other, which, you know, that would make you very presidential. I'm sure. That will be my only political comment today, or in this interview, I promise. But I guess I'll ask Matt first, but I want to know from both of you, have either one of you ever volunteered for a drug trial of any type before now?
No, I don't think I have. So first time.
Same as for me.
Yeah. So why this one? Again, I go with Matt first. Why this one?
Well, it seemed like a pretty good time to get involved in the screening process, given the breadth and issues that we're facing with the pandemic. And for me, my grandfather was a research physician his entire career at Washington University in St. Louis, and was very, science oriented and medicine oriented, and kind of raised us as grandkids to, trust the science and believe in the science. So I felt this was a good opportunity to, not only help out, through this process and hopefully do some good along the way, but to sort of reaffirm what I think it seems to be a wavering commitment to science-based review in the country right now.
Thank you. And Britt, you sound like you agree. So more to add?
Yes. No, I wanted to be involved, wanted to help. I'm not married and I don't have kids, and so I kind of saw myself as a bit of a. I don't know. I remember hearing about the woman in Washington who was one of the first people to be given the vaccine, like back in April or March, one of the vaccines, and she was a mom of two kids and doing it to help her kids. And I just remember thinking, well, I don't want anything to happen to her, and I don't have kids, and I'm not married, and so if I can help in any way, I want to, and hopefully it does.
Very altruistic of both of you. Thank you for your service. It's on behalf of everybody. So, how did you decide which trial to participate in? Did you have a choice?
I did not, at least, or at least I guess I don't think I did, or if I did, I didn't pay any attention to it. I sort of responded to a survey, I think through literally like a Facebook ad or something like that, and it did not indicate what trial it was for. It just said, do you want, if you want to participate, fill out, it was 8 or 10 questions to see if you qualified. And then I think they told me when they called, they reached out about, I guess 3 or 4 days later, I got a phone call from one of the people working in the trial, and they said, oh, it's for the Moderna trial, and can you come in on one of these 3 dates. So I mean, I suppose I could have filled out more surveys and kept asking around, but I wasn't particularly choosy in the process.
Yeah, I had just been trying to find one, didn't live close enough to any of the studies, and then Iowa Public Radio in their weekly e-news had said that there was one at University of Iowa, and so I emailed immediately and said, I'd really like to participate. Are you still looking for people? Because I think they had said they already had a deadline, and they said, nope, we'll definitely take you.
Good. Britt, I think I remember you told me you're driving an hour each way for the vaccine?
Yeah, and Midwestern standards, that's nothing. Yeah, and I'm in the Pfizer trial, and so
Quick errand.
yeah. And so it then had been so 2 times for either the vaccine or the placebo, about 3-4 weeks apart, and then they'll follow me up over 2 years with blood draws every few months. And so I go back in for my first blood draw next month, I think.
So I'm sorry, did you say you've had both shots now?
Yes.
And Matt, are you expecting 2 shots also? Have you had
Yeah, and I've
both?
had them both. I had my first one in early September and the second one in early October, earlier this month.
And when do you go for your next checkup?
I go back in another 2 weeks in November for my third checkup, which is just a blood draw and a nasal swab, a PCR swab. And I know there's further appointments after that, but I think it gets a little more stretched out. It's like once a month for the first 3 months, and then I need to look at the protocols again, but I think it goes to every 3 to 6 months, something like that.
Sure. And Britt, did you have side effects from either of the 2 shots?
My arm felt like I'd been punched both times, like how I react to a flu shot.
Mhm.
And that was pretty much it. Yeah.
Did you have a flu shot this year?
I have not. I can have one in 2 weeks. I have to wait until I was done with both of the exposure shots and then wait 3 weeks afterwards. So I can go in for mine, in 2 weeks, and I will be going in for my flu shot as soon as I can.
You were planning on it. And Matt, side effects for you?
Absolutely none whatsoever, which frankly makes me think I may have gotten the placebo, because like Britt, I get a flu shot every year, and even that, and I tolerate the flu shot very well, but even that I still am kind of sore, on my upper arm for a day or two. So the fact that, I mean, just nothing from either shot, but who knows? And it's interesting just to hear the little differences though, because I just got my flu shot on this Saturday, today's Monday. And it was for the Moderna trial, it was 2 weeks after the second shot before you could get your flu shot. So I was eligible on Thursday the 22nd, and I got in on Saturday and did it then.
I had my flu shot on Thursday, and I haven't had any reaction to it at all. I mean, very mild soreness in my arm.
Yeah.
That's completely it. But I'm supposed to have the shingles in 2 weeks, and that.
Yes, get the shingles. Please get the shingles back.
Yeah, sure. I will. But it's that's supposed to have a lot of side effects, but whatever. So
it's less than whatever having shingles would be, I assure you.
Yeah, one of my colleagues just got shingles. She didn't know what was going on, and and she said she had put off getting the vaccine, and she got shingles, and she's miserable.
So Britt, what information did Pfizer give you before you took the vaccine or the placebo, whichever you got?
It's an observer blind, in that the only one who knows which I got is the person who administered it. It's not double blind in case there are horrible side effects. And I did ask, and eventually they will tell us which one we got. I'm not sure when. And a thorough medical history beforehand. One of the reasons also I did it was because not enough drugs are tested on women. We metabolize things differently. And I know they're always looking for more people of color and wanting to just make sure they've got a better sample of the populace, and understanding why people of color are so reticent to be part of trials, Tuskegee and many other things. Then trying to think what else. It was, this is a good commitment. Do you want to be part of it? And here are the, lots of things to sign off on, and said, yeah, I want to be part of this. And I had a really good discussion with one of the women as I was waiting. So you have to stick around for a bit after you get the shot, make sure you're okay. And just chatting with them, because like with the Moderna and the Pfizer, it's 2 doses, and the Pfizer one has to be refrigerated to like -80. And so she was saying, we've got to get it to 1 shot. We've got to get it so you don't need to keep it cold at -80, because like rural hospitals just don't have the facilities to be able to host to do that. And 1 shot just eat the best. And then she said, you have to do further testing. Can it be given with a flu shot? Does it need a booster like a flu shot? Is it one for all? Is it a tetanus? And all the additional testing that will go on for years from this. So it was a lot of stuff that I hadn't thought about. And it's just, they're really doing this very well and thoroughly.
Good. What was your impression, Matt, on what they
Yeah,
told
I mean, very, very similar. I understand the Moderna trial is actually a true double blind, but maybe I'm also not a scientist, so I may be mishearing things or misunderstanding what they're telling us. But it was similar to Brit. The first appointment, they do an initial quick screening when you get there to make sure that you really do truly qualify, because they don't want to waste your whole day if they're not going to admit you anyway. So we did a kind of a brief sort of 2-page questionnaire, and then they told a couple people they could leave and the other people stayed. But then it was the better part of a day on that first visit, which was a very thorough informed consent presentation by one of the technicians that runs the lab, or runs the program. Then blood draw, nasal swab, a very thorough medical history with one of the physicians that's running the trial, a full physical examination by the physician, and then the last step was the first dose or first placebo, and then like Britt, followed by kind of a 45-minute waiting period before you're clear to go, just to make sure. I'm presuming they're worried about anaphylactic shock and things like that. So, and that was a better part of the day. The second visit was much shorter, just because it was more streamlined and no real paperwork or anything to do at that point. Just another blood draw, another PCR test, quick visit with the doctor, to make sure everything's fine. And I don't know about you, Britt, but I had an app on my phone that for the week after each shot, it prompted me every evening. I had to take my temperature and report any side effects. And so I was doing that for a week after each shot. And then I get a weekly call from the clinic, which is basically, are you alive? And are you healthy? And if not, what's wrong? And the other thing they always ask is, if you started taking any new medicine, because they're obviously keeping very close tracks of what other medication you're taking.
Oh, I don't get called. I just get let us know if something horrible happens.
No, they call. The Moderna folks are calling every week for now. Then I think it goes to every 2 weeks and so on. But and they're very persistent. Like if they'll call like 3 times a day until you pick up the phone and answer them. I mean, the other thing I thought was very interesting, and Britt, I don't know if you had this, was, obviously, as I've read about this and learned, they actually want some people to get COVID and get sick. That's how you kind of prove whether it's working or not. And the protocols they have in place for if you become symptomatic, I thought was really, amazingly thorough, which is like, get yourself here ASAP. All of your medical coverage is covered. We're very fortunate to have very good health insurance. I'm not worried about that, but I think for some other folks that may not have good coverage, this is actually a way that they're going to get top flight medical care if they actually get sick with this. Because at least the clinic where I'm going, there's page upon page of, if you get sick, do this, and we're going to monitor you, and you need to come in, and we're going to call every day, and we'll send a nurse to your house. And I was very impressed by sort of how thorough that process was.
Oh, I was sent home with a kit that if I start to suspect, I'm supposed to do a self swab and send it in immediately,
Okay.
and then they'll let me know what happens. And mine, I don't remember them talking a lot about if I were to get sick and what would cover with it. There was a lot more of, if something goes wrong, here's what we're covered and here's what you're covered. But I'm really glad they're that thorough with it.
Right.
One of the things I remember pointing out with the medical history background, because Matt, did you do your junior year in Wales, if I remember correctly?
I did it in England. Yeah.
In the UK. And I was in Scotland. So
right.
I'm not allowed to give blood.
Yeah, me neither. Yeah.
And that was one of the things, like, well, any other thing I might develop mad cow at some point.
Yeah.
And when I was in the office listening, waiting for my time afterwards, there was a woman taking a prospective caller, and the woman was really interested in doing the study, but she's an active blood donor, and you can't get blood for a year after being in the trial. And so that was really dissuading her. And because I said, would it be helpful to have someone, like a testimony from someone who's in it, to chat, to say, here's what my experience has been. And then said, but I'm not allowed to give blood, at least in this country. And I understand, I miss it. I'm O and egg, and they loved me, but
yeah, I'm the same.
Yeah, if I'm back in the UK, I can give, but not here.
Yeah. Yeah, and I always want to tell them too that not only is that a ridiculous restriction on giving blood, but I was a student and I didn't have enough money to afford beef when I was there. I was eating chicken the whole time. So.
Oh, and the rugby team always got these little beef pies.
Yeah.
That was like the meal most of us got fed afterwards. So, and I became a vegetarian actually while I was like.
I was actually in England during the mad cow thing. I actually ate beef. And even though I was only in England for a week, and I did not tell the American Red Cross that I had eaten beef, they restricted me from giving blood for a year also. So.
Oh yeah, just for traveling, because you could have been
Yeah.
exposed through other areas, other ways as well. Yeah.
Yeah, it was a stupid risk to take, but oh well, I lived.
Well, it's not one that you would think. You know, I mean, I got, you know, I'm barred for blood from living in the UK, not from being in Central Asia 20 years ago. You know, it's just the different expectations.
Mm-hmm. So did they talk to you about, I mean, are they encouraging you to move freely around crowds? Like they want you exposed to the virus. And they obviously, in America, we've made the decision so far not to do a forced exposure, which is pretty controversial. But in the meantime, are they saying, and by the way, forget the masks, or, you know, and they're not saying anything about isolation?
They couldn't do that out here because I mean we've got a mask mandate in the District of Columbia as well as in Virginia where I live. So I mean they just, you know, they'd run crossfits of that. I mean what they did on the Moderna trial at least was it was part of their screening. You had to say that you were in some categories where you had a opportunity to be exposed. And so for my family, I ticked 3 of the boxes, one of which is my daughter is back in class in person in school. The other is we will go out to eat at restaurants in our neighborhood where we kind of know the owners. We've been there for years and we trust the steps that they're taking. And the third one was I've actually gone back to my gym where I work out with my trainer. So that was enough for them to say, okay, just if that's what you're doing, that's fine. They just didn't want, you know, the true shut-ins who are like, you know, I get all my groceries through Instacart and I haven't left the house since March. And, you know, so you had to sort of show that you were engaging in some activity where there was at least an opportunity to be exposed.
And that's Moderna. Pfizer, Britt, did Pfizer do the same thing? Or?
No, and I'm trying to remember too. I mean, you have to give them your work background and what you do. I mean, I work from home part of the time and I work out of the home part of the time. And living in Iowa, we have a governor who refuses to order a mask mandate. Says she trusts Iowans to do the right thing while she violates her own resolutions and declarations. Sorry, I'm very frustrated with that. And
everyone gets one political comment. That's it.
Yes, and we're now like double the national what the average should be, and it's just scaring me a lot. And being around folks who think it's a hoax, it's very frustrating because, you know, like when you're doing something to help other people, you just kind of hope and expect that other people also are caring about other people and want the best for others, and you realize not everyone does.
Sure. I'm sure you both heard that 2 of the vaccine trials were stopped temporarily, and both of them have been started again in the US. Mm-hmm. AstraZeneca actually started again several weeks ago or a week ago in Europe, and America dragged its feet a bit on that. Did that give you a moment of scare?
It gave me a pause, but also I knew the risks going into this. I mean, one of the reasons I wanted to do this was to help if there's a risk that maybe I could catch something to prevent it from someone else getting or developing something worse.
Mm-hmm. Yeah, I guess I will say I certainly was aware of it. And I always sort of read the news articles I see when they're talking about the vaccine research, but it didn't give me a lot of pause. I mean, and it's, you know, it's my own, not fault, but it's definitely, you know, the curse of the middle-aged white guy who still thinks he's pretty invincible and is pretty comfortable in his white male privilege to think, oh, well, that won't happen to me. I'll be fine. So there's definitely an element of that. And just, you know, I like to think I'm relatively young. I guess I'm not anymore, but I'm under 50. I'm in good health. You know, I get a cold a couple times a year and that's about it. So I figured and again, sort of going back to the sort of science-based thing, the odds are definitely in my favor, and I'm willing to believe the math and believe the science, and not expect or be worried that I'm going to be the 1 in 2 million, people that has that action or reaction.
I don't want to violate anybody's privacy, so I'm going to try and phrase this correctly and politely. Did either of the trials have any limitations on comorbidities or chronic diseases or continuous, drugs like statins or something that you may or may not be taking? Was that something that was flagged in the screening process?
I don't think so. I think, and like with the Pfizer one, while I was there, they had already expanded it again. When I started it, it was 18 and up. And while I was there, I had to sign a new consent form because they had lowered it to 16. And in some places, I think they've actually expanded and lowered. I think Pfizer at least is just trying to get as many different types of backgrounds and people as possible to be involved with this, so they know any potential interactions with things.
Mm-hmm.
I don't remember anything on the comorbidities, and just looking around, I just think back to sort of looking around the waiting room of the other people that were in the trial when I was there. I don't mean to sound crass or rude, but they certainly weren't screening out for obesity. I mean, there was several people there who were clearly overweight and were being allowed to proceed through the trial.
Yeah.
In terms of medicine, they didn't, I suppose probably to ensure that people were truthful, they didn't tell you in advance, oh, if you take these medicines, you can't be part of this, I guess, because maybe they were worried that people would say they didn't take them and they really did. But you have to give, I gave them the list of, I'm on a couple maintenance medicines, and the doctor kind of shrugged her shoulders and went to the next question. So whatever I was taking wasn't an issue for her.
Good. Yeah, I know I'm very, I and many people are very anxious to be certain that the trials are including people with various levels of health. And you guys are both clearly visually very healthy. I think in my last question, what advice do you have for healthy people enrolling in clinical trials in the future? Is it something you'd recommend doing, or?
A good question.
If it's important, go for it. I mean, I know some people, for whatever reason, do it as a source of income. There are some compensations for different trials. I didn't seek it out for compensation, and I was kind of surprised when they did. And then several friends were like, take the compensation. And I was like, because that's not what I was doing it for. But it was also, I know of other people who do, like who sell plasma and things like that because they need the income. And so it's just a reminder about disparities in income and wages across the country. But, I think if it's something that's important to you, definitely go for it and look into it. But, also be aware of the risks. But, I'm doing this, so hopefully it helps somebody else not have to deal with something horrible.
Yeah, I mean, I would just sort of echo that. Like Britt, I didn't seek it out for the money. There is a fairly modest stipend that comes with it, but it's certainly not life-changing for anyone on this call. It could be very important, obviously, for others. I mean, I think, it's going to depend on the medicine and what's important to you. This one seems like a pretty clear no-brainer given the global reach and the global scope. If you're asking me, would I, sign up for a trial to try out a new psoriasis drug or something like that, that's probably not going to be as high on my list, just because that's not an issue that affects me or my family. And that may be a bit selfish, but, given that we do know there's some risks out there with these things, I think for me, it had to be, something where I really felt like that doing this was going to be benefiting larger society as a whole, or it's going to be something that's very close and personal to my family or my friends, having if you lost a loved one to something or something like that.
Sure.
One thing I did mean to mention was, considering our history of DS and medication with pregnant women, and I'm guessing they didn't ask you, Matt, but they did. I had to do a pregnancy test twice because they don't want currently they don't want any pregnant women in the trial. Yeah. And if you become pregnant, you have to let them know, and then then they figure out where it's going from that. But they were very clear on that because of however it could affect a possible fetus. But yeah, they were very upfront about that and very clear, and you can't get out of the test. You can't even just say I'm not pregnant. You have to do the urine test.
Yeah, I mean, I certainly saw those questions on the form. I know Moderna was screening for that. I obviously don't know, what they did beyond that. I mean, I think the one interesting thing that I guess, just as we're talking about it, that I didn't get a clear answer from the clinic, either because they didn't know the answer or they were just choosing not to share it at the time, was what happens if we get a working approved vaccine that's not one of the ones we're in the trial for. So if the AstraZeneca vaccine is approved next month, and obviously, I'm not going to be in the first wave, but as it starts to roll out, like Britt, this is the Moderna trial, I think runs 3 years. And, should I get the AstraZeneca? Do I not get it? What I do? And the most the doctor sort of offered us at the time was, you can drop out of the trial anytime you want. Like, no one's forcing you into this, and you can always quit, which I think was sort of her way of saying, if you want to quit and take the new, whatever comes out first, that's fine. But there wasn't a clear answer on that. And I think partly because it was still fairly speculative back in September of what the timeline looked like. I do think it's going to be very interesting if an AstraZeneca gets, or even if the Moderna one gets approved, and I don't know, did I get the vaccine or did I get the placebo? And do I, so I think those are the questions that I think a lot of, certainly that I'm going to start asking as soon as something gets approved. I still have, my mother-in-law is in her 80s and lives half a mile away from me. My parents are in their 70s and haven't seen them in 9 months, and we want to be able to get people together. So as much as I support the science and want to be a big, supporter of that, if it means I can't, take my daughter to see her grandparents for another year and a half, that's not really going to work.
I guess that is.
Oh, Matt's mom was always my favorite sub. Like, she was just the best. Sorry, and that was an okay symbol. Sorry, I realized.
Yeah. I did not mention at the beginning that this is a coincidence that we found both Britt and Matt. Britt, I knew that Britt was in the vaccine trial because she works with the ES Action, and I'm the executive director of that. But then Britt found out that Matt was in the other trials, so they knew each other in. I thought it was college, but it makes it sound like
high school. Yeah.
High school.
Yeah, we both did 4 years of Russian. Yeah, there were the four of us for 4 years.
Russian, none of which I have none left.
Oh, yeah. I minored in it, and
God.
Yeah, and I talked to my cats in Russian, but I don't have anybody else to practice with.
Good. Just one random question I just remembered. Before you did this, did either one of you call your own personal doctor, your internist or general practitioner, just to say, I'm thinking about doing this? Any thoughts? Or did you let them know you were doing it?
I didn't. I did afterwards because I just had some things to check in and said, by the way, I'm also in this. But that was one thing that some people did recommend. I said, maybe talk to your doctor beforehand. And I was like, well, I'm in pretty good health. I don't think it's going to be an issue, but maybe it's also just, assuming my privilege of being in good health.
Yeah, I did not either. The Moderna trial, they asked, do you want us to let your doctor know? And if so, give us your information, which I did. But, again, just given the stress on the health system now, I mean, I'm not trying to bother my doctor unless I really, really have to. So I assume she's gotten the file from the research clinic, but I don't know. I haven't spoken with her about it. And she hasn't certainly reached out to me to express any concerns.
So really, last question this time. Thanksgiving's coming, and I know I am struggling with how wide a net I should cast with family members at the Thanksgiving table I sit at. Matt, it sounds like you're still keeping very much to family pod.
We're doing local. We're going to do, actually, we had this discussion yesterday. We're doing local family Thanksgiving, which is mostly my wife's family. So my family is now all in St. Louis, Missouri, and they're going to stay there at least for Thanksgiving. we'll do Thanksgiving with my wife and her mother and sister and brother who are all in the area. And, you know, fortunately right now, you know, DC, Virginia, Maryland, the metro area is trending pretty well compared to the rest of the country. What I'm trying to figure out is the Christmas holiday in December and whether I can get my parents out here. We have sole possession of the only grandchild, and so they're desperate to do something, and we're, you know, what I'm trying to broker is getting them out, try to get them to drive rather than fly, and ask them to come out for an extended period where they can sort of, you know, shelter in place for 2 weeks in our house. Luckily we have the space for them, but, you know, say, why don't you come out, you know, week after Thanksgiving and stay through the new year or something like that. So we don't have a lot of in and out and movement around.
I haven't seen my mom since February, and she lives 2.5 hours away in Des Moines. We had at one time thought about trying to just meet halfway in between in Iowa City outside, and even that she's not comfortable with. She's in her early 70s, generally healthy, but you know, she's a little nervous about it, and I'd really like to see her, and I haven't, and I won't be able to for I don't know when.
My mother-in-law is 97, and she's like, something's going to get me. I am not going to worry about it. So God bless her. She's healthy as can be, and, you know, remembers everything. So that's good. Well, okay. Thank you. I'll let you go. Again, thank you. Thank you. Really. I sound silly, or sarcastic, I think, but I mean it. You know, what you're doing is, it's benefiting so many more people, and I really do appreciate it. And I'm sure many others do too. Thanks again.
Thank you. Happy to participate. Have a great day.
Thanks.
Bye-bye.
Bye.
Bye-bye.